Okay. Okay, yay. Welcome. So we have Katie Kirkenmeyer here. Katie is a mental health therapist who specializes in infertility and is certified in perinatal mental health. She's a member of the American Society of Reproductive Medicine's Mental Health Professionals Group and is passionate about helping individuals and couples experiencing infertility, which I can say. She's great help because she helped me too. So, welcome, Katie.
Thanks for having me. I'm excited to be here to talk about this today. Yeah.
Okay, so just kind of to start, um, what would you say would be like the most common mental health challenges that people face during like their fertility journey, especially if they
Yeah.
start to experience or go down the road of infertility?
Yeah, definitely. So, I mean, there's a lot of things that can pop up. I think one of the things I hear most commonly from people is frustration with just the waiting, how much waiting there is, waiting for your cycle to start, waiting for an appointment, waiting to get into a clinic,
Yeah.
waiting for,
A 2 week wait.
the 2 week wait, yes, to see if your period comes or if you get a positive pregnancy test. And, oftentimes wait lists for certain, if you're seeking a reproductive endocrinologist, can be over a year long, and you've already
Mhm.
probably been waiting a whole year to try to get pregnant on top of that.
Yeah.
So much waiting can be really, really challenging because it's not like when you're trying to get pregnant, if it doesn't work out, okay, we'll just try again tomorrow,
Right.
right? Our cycles unfortunately don't allow for that.
Right.
And so we really only get 12 chances a year if we're having regular cycles on top of that. So it can be really, really challenging, the waiting. And then if you've jumped all the way to IUI or IVF, then the wait can be even longer. To prep for a transfer, wait to get on the calendar, get on the schedule, because it's
Right.
all very controlled. So
Hmm.
definitely the waiting.
And
And
the
then I think,
uncontrollable.
yes, yes, definitely. Yeah. And how much the loss of control, I think,
Right.
is a really, really big thing
Yeah.
uh, for people experiencing infertility. And there's so much, I think, as women, right? And men too, but I think as women in particular, we're taught that, right, like our bodies are just supposed to be able to do this,
Right.
and being pregnant is natural and it's supposed to come really naturally. And so then when it doesn't, that can cause a lot of identity issues too, of what does that mean? Or feeling, is there something wrong with me? Am I broken? What does
Yeah.
that mean about my ability to be a parent?
Hmm.
And that can really cause a lot of stress and frustration too. And then alongside that, I think comes a lot of grief. There's so much, I think a lot of us have had um maybe expectations or thoughts about like how we would tell our partner when we were pregnant or what that would look like.
Or a timeline.
The
Like, I'm going to
timeline,
get married at this age.
exactly.
I'm going to get pregnant at this age. I'm going to have this
Yes.
many kids by this age.
Yeah, right. Yeah. Yeah. People, I'm gonna get married at this time, and then as soon as we get married, we're gonna start having kids, and then we'll have three of them by this time. So yeah, what's that like when that doesn't happen, and grief of that? For sure. There's so much grief about, and I think each stage, right? How there's grief about how long it's taken, how it's working or not working, right? If you have to use any sort of medical intervention to get pregnant, if you're not the first person to find out you're pregnant because you're using,
Yeah.
reproductive technology, not getting that control over your own body even. So there's a
Right.
ton of grief that comes along with it too.
Yeah, I think too, something I've heard a lot of my patients talk about is like the grief of, well, and the inability to control like when you pivot, like when you go from
Yeah.
one, like we're doing this,
Yeah.
now we need to move on to this, whether that's
Yeah.
like it's been a year and now we have to see
Hmm.
a reproductive endocrinologist. It's like now I'm in that category that I never thought I would be in
Right.
of
Yes.
infertility.
Yeah.
Or,
Yeah.
you're doing IUIs and then they recommend IVF and you're like, now I'm in that category. Just
Right.
like, or if you're
Right.
going to adoption or surrogacy or
Yeah.
whatever it is,
Yeah.
that like acceptance and grief of pivoting and changing
Yes.
directions and not having
Yes.
control of which direction you go or feeling
Yes.
like you don't have that control.
Right. Yeah, exactly. Yeah. Feeling like, okay, well, if I want to have a baby, this is how I have to do it. And this isn't what I pictured.
Right.
And that really it feels really devastating. And even, having a baby with reproductive technology is not cheap. And so even grief of, I've had clients cash out their 401ks to pay for IVF.
Yeah,
And,
definitely.
there's obviously grief and loss in that too, of like,
Right.
okay, what does our future look like financially that we
Right.
had to use this money that we were saving for a down payment on a house or,
Um,
and that there's grief of, okay, now our lives are going to look vastly different because we don't
yeah.
have these finances anymore too.
Right. Which can I feel like also lead to like strain on your relationship,
Yeah.
especially if there's financial,
Yes.
issues,
Yes.
then that just makes it harder for you and your partner.
Yeah. Yeah. Because maybe you disagree, right, on
Right.
what that money should be spent on. And then
Yeah.
on top of it, right, when we're actively trying to conceive, right, that puts a huge stress and strain on intimacy, on physical
Oh yeah.
intimacy. If we're only experiencing intimacy because we're trying to get pregnant, that adds a lot of pressure and stress on it. And then it doesn't necessarily always maybe feel like genuine, or we don't feel as connected. We're feeling forced. And
Right.
that doesn't always feel good in our relationships either. And then if you're doing IVF, there's a lot of restrictions of not being able to have intercourse and not be physically intimate when you're going through
Right.
treatment, which also can put a strain on relationships. So there's
Right.
tons of avenues that can really
Yeah.
impact our mental health
What
during.
is
Yeah.
intimacy?
Yeah, right. Yeah, yeah.
That's like the
Yeah.
big question when I feel like when
Yes.
you're going through your fertility journey and dealing with this stuff, it's like you don't even know what intimacy is anymore.
Right. Right. Yeah. Yeah.
Everything
Yeah.
has a purpose, and that purpose is to try and
Yes.
make a baby, but it's not, doesn't have
Right.
to do with your relationship.
Right. Yeah, exactly. Yeah, we've totally thrown like emotional connectedness out the window to most
Yeah.
of the time at that point. It feels like, yeah.
Yeah. I feel like too, and I'm a pelvic floor therapist, so I talk about, all things
Yeah.
pelvis and,
Yeah.
intercourse and all of that. And I kind of joke like if I was the male, there's no way that I could ever get get my wife or whoever pregnant because there's no way I could
Yeah.
perform in a
Yeah.
way if it
So
feels
much
so
pressure.
forced and there's so much pressure on it. Like I
Yeah.
don't do good under pressure. And so
Right. Yeah.
even from the male perspective, that's so hard to
Yeah.
just all of a
Yeah.
sudden like be able to do what you need to do. Like
Right. Right. Exactly.
put
Yeah.
just pressure
Yeah.
on themselves and like I don't know, I
Right.
feel like too, and I don't know how the men feel, but just seeing my husband go through it, it's like do they feel like they're losing their masculinity if they're
Mm.
not able to do what they're supposed to do and they're meant to do too?
Right, right, right. Yes, of course. Yeah, yeah, yeah. Because similarly, right, I think the same way women feel like, oh, I'm supposed to be able to get pregnant
Right,
and carry a baby,
right,
you know, men are supposed to be able to get a woman pregnant, right?
right,
That's the
right.
societal expectation, right?
Mhm.
Um, is that I can, it's the whole line from Mean Girls, right? Like, don't have sex, you will get chlamydia and
Yes.
die, right?
Yeah. Yeah. Yeah.
Yeah, yeah. There's all
Exactly.
these. I mean, that's not about pregnancy, right?
No,
But
but like you'll
um
get pregnant.
yeah, exactly. Yeah,
So
exactly. So yeah, it's definitely there's definitely pressure for them too. And I think that's even and we'll talk a little bit about this more as we go on, but
yeah,
men are even more stigmatized in the infertility world, right? Because it tends to be, I think, societally a women's issue.
right.
And it's not always the case.
Yeah. I think too, just coming from the perspective of like someone who's gone through some sort of infertility journey is like you said, the societal expectations, just like not of just a woman and a man, but like as a person in their 30s, like, oh, you're 34. Well, shouldn't you
Mhm.
be married by now? Shouldn't you have a partner by
Right.
now? Shouldn't you have
Yes.
kids by now?
Yes.
And then family members being like, or if you do get married, like right after, like, why don't you have any
Mhm.
kids? Don't, like,
Right.
when are you going to have kids? And even if
Hmm.
you're not going through an infertility journey and you're single and you're like, I'm trying to get married, or, you don't want children,
Right. Yeah.
And
Childless by
society is
choice.
just
Yeah.
saying like
Yeah.
just like the societal pressure, I
Yes.
think is a lot to handle during like infertility too.
Yes. Yes. Absolutely.
Yeah.
Yeah.
Especially from your loved ones that don't realize it. Like if you're not open that you're going through it.
Yeah. 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 So much pressure about like, when are you going to have kids? When are you going to make me a grandparent? And
Right.
not realizing,
Yeah.
how that can really add pressure and
Yeah.
make someone feel awful, like they're,
Right.
just about to explode inside.
Yeah. Or even if you are open about it and people are like, well, just relax, then it'll happen.
Sure.
Or
Yes.
just stop thinking about it.
Yeah, just go on vacation. I know somebody that went on vacation and they got pregnant, right? All these
Yeah.
well-meaning,
Right.
old wives' tales that, they don't like just relax doesn't account for a lot of things
I
in the
know.
infertility world. Yeah,
Yeah.
yeah,
Or they're like, don't think about it. And you're like, well, I have to time it exactly right. Or I
yeah,
have to put in this trigger shot. Or I
yes,
have to, my husband has to have fresh sperm at this time. Or
yeah,
I like, you can't not think about it because
right,
you have to track what's going on every
yeah,
day.
yeah,
Like, and what your body's doing in order to make it happen. So it's like,
right,
what do you mean don't think about it?
right, yeah, yeah. I have to think about it. Yeah,
Right.
I have to be paying very close attention.
Yeah. So,
Yeah.
needless to say, there's
There's a lot. There's
a
a
lot.
lot of things that come up. Yes.
Yeah. So I guess with that being said, like why does mental health matter in fertility?
Yeah,
How would you
yeah.
say?
So, I mean, we know that stress has a ton of impact on lots of different things, right? Like our systems are all linked together, right? So,
Hmm.
when our bodies feel stressed, they send out different hormones than when we're not stressed. And I know you're going to talk a little bit more about the hormonal impact of it all too.
Yeah.
But stress hormones impact things like ovulation, which we absolutely need in order to get pregnant.
Right.
Um, and there, what I tell clients all the time is like, in order for our body to feel well, we need to feel emotionally well, right? If you've ever, and I think a lot of people have experienced this, where if you've gone through a significant period of stress in your life, right, our bodies tend to go into, when we're in states of crisis, we go into, fight, flight, or freeze mode. And
Hmm.
we're just running on adrenaline and
Yeah.
high stress. And then when that event stops and the stress subsides, most people have this experience of like they get super sick at that because their body has
Huh.
finally rested,
Right.
and then it knows it doesn't have to be fighting anymore, and then our immune system completely just is shot.
Yeah.
And I use that example a lot because we have to make the connection of like, yes, we can tolerate stress, we can tolerate emotions, but it is taking a physical toll on our bodies too.
Yeah.
And we need our physical body in order to get pregnant.
Right.
So
Right.
managing this is really, really, really important,
Yeah.
in order to be able to get pregnant, to stay pregnant. And also, we want to be able to manage anxiety about this. We want to be able to manage our emotions surrounding it. We don't want to constantly feel like I'm just waiting for the other shoe to drop
Yeah.
if
Oh,
when
yeah.
I finally do get pregnant, right?
Oh, yeah.
I want to be able to enjoy this thing that I've worked so hard to get to,
Right.
not just be in this constant state of fear,
Right.
too.
Right. And it's funny you say this because it's like a good reminder because
Yeah.
sometimes, sometimes we tell our patients things and then it's like, it's a good reminder for someone else to say it because then I
Yeah.
remember it for myself. But I tell my patients all of the time, like a lot of the people, even I see, like see for Mercier, but even see for pelvic floor therapy
Mhm.
are in that like fight or flight state. And some of them don't
Right.
even realize it
Yeah.
because our society is so like go, go, go,
Yes.
on, move
Yeah.
on to the next thing. Like we don't really take breaks. And a lot of I'd say majority of my clientele are like type A, like me, and
Hmm.
they're like, I want to control everything. And if this doesn't work, I
Hmm.
go to the next thing and I go to the next thing. And our bodies are so like uptight and like
Yes.
in fight or
Yeah.
flight.
Yeah.
Happens is like all of our blood flow goes to our limbs, right? To like
Mhm.
use our muscles and run away. And so it
Mhm.
goes away from our organs. So like our
Right.
reproductive organs, so like our
Right.
ovaries and our uterus. And so those organs aren't getting the blood flow they need. And if they don't have blood flow or mobility, then they can't optimize their function, which
Right.
can in turn affect hormones. And then you've got your cortisol hormone, which is your stress hormone.
Mhm.
And if that is elevated, which happens when we have stress, it
Mhm.
affects all the rest of our health hormones. I mean, it affects our estrogen, progesterone, testosterone, thyroid. Like if you're going through fertility, I'm sure you've heard of all of these things being tested, but
Yes.
it affects all
Yes.
of that, which, like you said, can affect our ability to ovulate or our
Right.
ability to, make a follicle
Mhm.
or, just it actually physically affects our ability to get pregnant, which I don't
Mhm.
think a lot of people understand.
Right.
They think like, I want to get pregnant, so I'm just going to do all of the physical things I need. Like I'm
Mhm.
going to, you know, put in the hormones in my body or take the medication or do the acupuncture, which I think is great, or the
Yeah. Oh, for
chiropractic or
sure.
the
Yeah.
PT, but like
Yeah.
mental health is just as important
Right.
as
Right.
all of the
Yeah.
physical stuff.
Yeah. Yeah, and when when you're going through infertility, it feels so all-encompassing of your time, right?
Right.
It feels like everything is surrounding your cycle, when your next appointment is, when your next shot is, when your next medication, right? Your fertile window, when you're going to be able to have intercourse, right? It feels like your whole life just surrounds
Mhm.
infertility. And so because that's such a focal point, if we're only focusing on that and it's the infertility is feeling really stressful because of the nature of it, then we're just
Right.
in a constant state of stress,
Right.
which
Right.
impacts our mental health. So it's this like very cyclical, problematic cycle.
Yeah. Yeah. And I,
Yeah.
I don't think people realize too that it affects the male fertility too. So like
Yeah.
if the male partner is stressed and
Hmm.
has that high levels of cortisol and their testosterone is affected, then that can lead to lower sperm count and reduce
Yeah.
sperm motility,
Yep.
which, if you have that, then that reduces your
Right.
chances
Right.
of getting,
Right.
a sperm to the egg to fertilize and get
Yeah.
pregnant. So it's like it's
Yeah.
not just
It's not just, yeah, not just the women. And
women.
yeah, I mean, 30% of infertility is male factor infertility, which is a pretty significant, number when we're talking
Yeah.
about it. And again, I think we think so much of this as a women's issue, but
Yeah.
we've heard it, it takes two to make a baby, and it
Takes two
really
to
does.
tango.
Yeah, it
Say
does.
that all
Yeah.
the time.
Yeah.
I know, and I know we'll talk about it later, but like talking about like a whole couple approach, is what
Yeah.
you're looking for.
Yeah.
If it is you and a male partner.
Yes, totally. Yes.
But
Yeah. Yeah.
yeah, so yeah, having it affect you physically is huge, but also I do feel like just in general, like it's so important in fertility because if you are in a partnership, like you're
Mhm.
not using like a sperm or an egg donor, and it's you and someone else, like your relationship matters. And if your relationship's being strained, like not only does that affect, your fertility because you have to work together to make a baby, but it affects your support system and your relationship or your marriage if you're married. So it's like,
Yeah, yeah,
I feel like that matters a lot too.
yeah, yeah. And
It'll affect that and everything else, like your work.
yes,
I don't know
yeah.
what you've
Well,
experienced,
I think infertility is already so isolating. I think that's the
right?
thing that I hear the most from
Hmm.
people that I work with is like, I don't feel like anybody gets it. Nobody truly understands what I'm going through.
Hmm.
And they feel so alone. They feel so isolated in it. And so then I think to your point, if we have a partner and we don't feel on the same page as our partner about it,
Right.
or we're not feeling like we can be honest with them, that's an extra layer of isolation, of
Yeah.
feeling like completely alone in it.
Right.
Um, and depending on who's having more procedures or tests,
Right.
right? Like that's even lonely. Of if you're having to go into your clinic by yourself all the time and your partner can't be there or doesn't want to be there, it adds, again, there's another layer, another chip in that isolation.
Yeah, definitely. Yeah, sure. Yeah, I know too, just like from my personal experience, having a partner and doing things together, like even though we both were experiencing, our own infertility journey and like trying to, make baby together, like our experience was completely different.
Yeah.
And like my body was doing different things than his body, and like
Mhm.
my expectations were different than his, and
Yeah.
my mind, I needed different things than he did. And I just know, from a partner perspective, you might not feel like you can feel all those feelings
Right.
because it's not your body getting
Right.
the hormones or getting, having to be injected or having to go to all of the appointments or tests, but you still
Mhm.
have the same amount of, grief, maybe isolation,
Right. Yeah. Yeah.
stress,
Yeah. Yeah,
you know?
absolutely. Yeah. And I think uh, because it's such an emotionally heavy thing that you're both experiencing, I think sometimes couples feel like they don't want to add to the other person's stress or emotional toll that they're taking, so then they're not honest about how they're feeling. So then they're just left kind of feeling that way on their own or not wanting to make the other person feel guilty. I mean, I hear that frequently from, you know, my clients too, is like, well, my partner has always wanted to be a dad, or my partner has always wanted to be a mom, and I can't give them to that. And I can't give
Mm,
that to them.
yeah,
And I feel terrible,
right,
about that. And so um they don't want to process how they're feeling because the level of guilt they already feel for experiencing infertility causes them to kind of close up and not be vulnerable, which is kind of the opposite of what we need in
right,
order to feel connected and to be able to feel intimate.
right. Yeah, just adds another thing to it. It's just,
Yeah,
yeah.
definitely. Yeah. Unfortunately. Yeah.
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 Okay, so how do you feel like mental health support can help you through your fertility journey?
Yeah. Yeah.
Like, are there different types of therapy, or like what do you kind of offer, I guess?
Yeah, yeah, good question. So, I offer a couple different types of therapy. So, I do individual therapy. I work with couples going through infertility. And also I do offer some support groups, on and off. But from an individual therapy perspective, kind of the theoretical lens I work with is from through EMDR, which stands for eye movement desensitization and reprocessing, which is an evidence-based form of trauma treatment. And that can be really, really helpful for targeting, negative beliefs we have about ourselves. People feeling like their bodies are broken,
Yeah,
not feeling good enough, feeling like you can't tolerate it. Also, internal family systems is another lens that I use, which really is about your relationship with yourself and all the different like parts of ourselves that we have, and learning to, we have so many parts that show up, especially in infertility, that can really look like shame, right? Or guilt, or,
yeah,
these like very protective parts of ourself that really want to get pregnant but can't. And learning how to be in relationship with all of ourself in a
right,
loving and like accepting way,
right.
and learning how we can all integrate, and be loving is another way of doing it. And then I think, couples therapy, kind of what we've talked about,
Yeah,
it can really help sort of facilitate communication, right?
right.
And create a safe space to just kind of explore how each other are feeling in
Yeah,
a way that right, I can kind of ask so it doesn't make it necessarily have to be the other person's putting pressure on someone
Yes.
to kind of bring out the emotions, and just creating a safe space to share with each other and navigate together like, hey, how do we support each other when
Right.
we're not experiencing the
Yeah.
exact same
And that way
emotion?
they don't feel like pressure to say the right thing. I feel like being
Right.
in a controlled environment with you as like a moderator,
Yeah.
I don't know if that's the right word, but
Yeah. That's
but
okay. It works.
um but like being able to be almost like more open and honest,
Yeah.
I feel like it's easier in that controlled environment with you. um, because you can be, because you can work through it there
Yeah.
instead of kind of feeling stuck.
Yeah.
Like, where do we go from here?
Yeah. Yeah. Yeah, definitely.
It's like say a safer environment, I feel like.
Yes.
Be more
Yes.
open.
Yes. And I think with any type of therapy, couples, group, individual, the goal is just for it to be a safe space that you can kind of just like, I think because there's so much societal pressure and expectation, and I think people are well-meaning in our lives, but people we have relationships with, personal relationships with, we have a little bit of like bias and opinion
Yeah.
for them too. And so we don't want to hurt someone else's feelings, or we may not feel comfortable. And so therapy really can just be like a truly safe space for you to just process through everything that's happening for you without having to worry about taking care of anyone else's emotions.
Yeah.
And I think one thing in particular that's really important about finding a therapist that actually specializes in infertility is getting someone that understands all the lingo, right? What everything
Yeah.
means. So you're not having to spend your own therapy session like educating your therapist on what a procedure is,
Right.
or,
Right. What the wait
or
times are like and
exactly.
how it
Yes.
feels to inject
Yes.
different
Yeah.
hormones and how that can affect
Yeah.
you physically. And
Exactly. Yeah. Yeah, and I think there's so much value in that, and it's really important to make sure um you have that too, so that it can truly just be a space for you to exist
right.
however you need to exist to
Right.
process through it. Yeah.
Right. Yeah, I did. I definitely, I mean, personally, I like to go to providers that somewhat understand what I'm going through, whether
Yeah.
it's a physical therapist, a mental health therapist, I don't know. It just feels different when you know
Yeah.
someone, even if it's not the same
Yeah.
me,
Yeah.
that they somewhat understand you
Yes.
in a
Yes.
way. It
Yeah.
just it's different. It means
Yeah.
more. And I think that's, something special you and I can give some of these patients. It's like, hey, like I don't know exactly what you're going through because we're all not all our journeys are
Totally.
not all the same. And our journeys to each
Exactly. Yeah.
each baby is not all the same.
Yep. Yep.
Um and but I'm here for you, and I understand the deep emotional toll that you're going through.
Yeah.
Don't know it, but I
Right.
understand how deep it can get and
Yes.
why.
Yeah.
You
Yeah.
know,
Exactly. Yeah.
so
Yeah.
I think that is a big part of it. Um, what do you, so being someone that's really indecisive and going through infertility, like how do you ever help out with some of that? Like, because I know, do people ever say like, hey, Katie, doctor said this, what should I do next?
Oh, sure. Yeah. Yeah. A lot of like, what do you think? Yeah, that can be so
Yeah,
tricky. Certainly my role is not to
right, to make
guide in
decisions.
any specific
Right.
way, but
But
it
I know
is to
decision
hold,
making is like a big
yes.
stressor.
Yes, it is. Yeah. And sometimes it is, right? Like depending on how you feel I have some clients who are like, I'll do IUIs, but IVF is a hard stop for me,
Hmm.
right? Or like I will do embryo adoption but I will not do gestational carrier, right?
Yeah.
And then what happens when we're actually faced with that decision?
Right.
And so definitely holding space for, okay, like let's really explore all of these options and
Yeah.
see what it would feel like if we went this way or didn't. And I think, so one of my roles, I'm trained to do screenings for people who are considering using third party reproduction in any way, so
Mhm.
donor sperm, egg donor, things like that. And that's really one of the purposes of that, is to really like, I'm going to ask you, all the questions that you maybe haven't even thought about, right? To see like, hey, is this something I'm still comfortable with or still
Right.
okay with? And so yeah, really just making space for what are all the potential outcomes and what
Yeah.
would it be like if any one of them happened? And let's just sit with how that feels.
Yeah. Which I love because I'm indecisive. So, and
Sure.
it's I wouldn't take the time
Yeah.
to do
Yeah.
that on my
Yeah.
own,
Yeah.
even though it's
Yeah.
what's important and will help me and my
Yes.
partner in the future. But it's nice to have like, hey, I'm gonna go see Katie from 5 to 6 or
Yeah.
whatever. And in that time, like this is when I think about me and us
Yeah.
and like finding what would work best for me through the assistance of you, not you making
Right.
the decision, but me making the
Sure.
decision
Yeah. Yeah. Yeah.
or us
Exactly.
making the decision if you're in it
Yeah.
with a partner.
Yeah. And
I
I
just think
think
that's
to your
definitely
point, like sometimes when you're in this, when you're in infertility, it can be really easy to get to a place of like, I don't care, I'll do anything just to have a baby,
right,
right? And not really like, are we really like, let's think about
right, right.
everything, right? Like, let's
Right.
slow down and
Yeah,
really think about it all and see what, like, where are our boundaries? What do we feel comfortable with? What do we not feel comfortable with?
yeah. And I do think too, like you get so much push from different providers.
Hmm.
You forget
Hmm.
that like this is also a business. And
Totally.
so,
Yeah.
like, you might feel pushed to do an IUI, pushed to do surrogacy,
Yeah.
pushed to do IVF, pushed, to wait longer or change
Yeah.
it or whatever. And
Yeah.
and you feel so much tug. And then
Hmm.
and then you've got your friends saying, no, drink
Yeah.
wine and you'll be fine. It's
Yeah.
just like you've got this
Sure.
tug from everywhere. And if you and your
Yeah.
partner don't agree,
Yeah.
it's just like all of these tugs from everywhere, and you're like, I want to do whatever, but I don't know what to do because I don't know who to trust because I'm
Right.
getting this push from everywhere. And so I just feel like having that time with you, whether it's individual or
Yeah.
with your partner, can
Yeah.
help open up that conversation for navigating these decisions and
Yeah.
these influences from the
Yeah.
outside world, whether it's your provider, different providers that disagree,
Totally.
or
Yeah.
your, loved ones.
Yeah, yeah, because I think sometimes our loved ones too, right, are well-meaning, but they have a personal interest in this, right? Like if your parent really wants to be a grandparent, they might really push something you're not comfortable with,
Right.
right? Or vice versa. Or if there's like a spiritual component
Yeah. Yeah.
that you differ in than your friends or family, like that can be really complicated too. So,
Yeah.
yeah, just having like a true unbiased space to explore your own beliefs is important.
Yeah. I have a lot of clients. I think when we're working together, whether it's pelvic floor or Mercier, I think people don't realize that they've had a traumatic experience or been through
Yes.
trauma. The way people define trauma, I feel like, is different in different people's eyes. And I feel like a lot of my clients have gone through traumatic experiences, whether that is like the frequent IVF injections,
Yeah. Yeah.
or it's a loss
Mhm.
or multiple losses or a relationship trauma,
Yeah.
or,
Yeah.
they had a delivery that was
Yeah.
traumatic and they're
Yeah.
trying to conceive the second, whether
Yeah.
that first ended in a loss or a life. But there's
Mhm.
so much that I've noticed that my clients have built up.
Yeah.
They, my, they are the strongest people
Totally. Yeah.
that I feel like I work with, but
Mhm.
they hold it all in.
Yeah. Yeah.
And I can feel that
Yeah.
physically in their muscles and
Mhm.
in their abdomen and in their,
Mhm.
hips and their back and their mental strength, or their holding in of that trauma and they're staying strong. It's causing everything to just like tighten up and cause physical, I mean, not just like hormonally, but like physical pain.
Mhm.
And I
Mhm.
don't think they realize that working through whatever
Yeah.
trauma they've had in the
Yeah.
past or
Yeah.
whatever trauma they're going through now
Mhm.
can help physically.
Yeah.
And I know a
Yeah.
lot of times when I'm doing the Mercier therapy on them, sometimes some of that release comes out
Yeah.
and it becomes emotional and they have
Yeah.
different kinds of experiences or
Yeah.
side effects. But I think um like seeing you and being able to like how do you help people through if there is
Yeah.
like trauma
Yeah.
or they don't realize they're experiencing it?
Yeah.
Like is
Yeah.
there a way you screen
Yeah.
for that or is there a way that you can help women through that?
Yeah, yeah, good question. So I mean, there is like a standard screening for like PTSD symptoms,
Yeah.
certainly. And I do think when we hear the word trauma, right, we think of active combat or like a
Yeah.
car accident
Right.
or, something like that, but it's so much more broad than that. And like infertility is very invasive.
Yeah.
It is a lot
Mhm.
of lack of control, right? Which there's a
Yes.
ton of parallels in trauma and lack of control. And
Yeah.
not to mention, unfortunately, right, a lot of people come to infertility because they've experienced recurrent pregnancy loss,
Right.
which is, that sort of like is what brings them to the infertility world because they can get pregnant but can't stay pregnant,
Right.
which
Such a
loss
roller
is
coaster.
totally, yes, loss is very, very traumatic. And unfortunately, even providers, when they're doing these really invasive tests, can cause trauma
Hmm.
of not really recognizing a client is actively triggered or
Right.
dissociating, or I mean, we know the
Right.
statistics for women, unfortunately, of being sexually abused at some point in their life, right, are very high. 1 in 4. And so when we're considering that, and then we're considering a really invasive procedure, right? Statistically, there's a very high likelihood that there's something going on there. And our bodies remember even if we're not cognitively aware of it.
Isn't that
Um,
interesting?
it so much,
And how our
yes.
bodies automatically dissociate, because I know
Yeah,
a lot of women that are
yeah,
dissociated with that
yes,
area
exactly.
and they
Yes.
don't realize it.
Right. We're floating. We don't know what's happening. We're shutting down. We
Yeah.
don't feel connected to our bodies at all, which can be really hard, especially, right. And I think as I'm saying that, I'm thinking about like if we're actively disconnected from our bodies because of trauma and because we're dissociated, how does that translate then once we become pregnant? If we do not feel connected to our bodies, we don't feel
Right.
connected to the pregnancy or the baby, right?
Right.
So there's so many reasons it's important to work through it because also
Right.
we are not meant to live in a state of feeling like we're like actively being chased by a bear, right? And that
Right.
is what our bodies experience when we have experienced trauma.
Right.
Until we work through that, like it does not serve us to continue to stay traumatized.
Yeah.
We are not mammals that like live in the woods that have active predators. So we need to break out of that in order
Yeah.
to feel grounded, to feel emotionally regulated. So
Yeah.
that's one of the things EMDR is super, super helpful for.
Mm.
So it's an
Oh yeah.
evidence-based form of trauma treatment. And it's very, very effective at targeting trauma. And it works not only with our emotions and processing through the actual incident, but also the body sensations that we also have, are lingering anytime we think of that trauma, right? Like, oh, all of a sudden my stomach hurts, or my chest feels tight, or,
Right.
my pelvic floor feels really tight, which is
Yeah.
something I
Or
heard a
my
lot.
scar
Yes, my
is
C-section
different.
scar hurts
Yeah.
really bad,
Yeah.
right?
Yes.
So working through that is really important. Like we
Yeah.
we don't have to continue to live that way.
Right. Right.
Yeah.
And I think of it too, like, okay, let's say you find, you get pregnant, right? Our bodies, like, if we're in that fight or flight and we're in that trauma induced feeling and we're running from a bear, like our body doesn't want to have a baby if we're running from a bear because that baby's not going to be safe.
Mhm.
Our body wants to have a safe environment to carry and eventually deliver a child. And so we need to create that safe environment to get that pregnancy to
Yeah,
stick and then to grow
right.
safely. And so I do feel like healing from that trauma through like mental health therapy, Mercy therapy, all of that is going to be important, not only to help, your body do what it needs to do to conceive, but also do what it needs to do to carry to term.
Yeah. Right. Yeah,
So
absolutely.
it
Yeah.
goes even further
Yes. Yes.
than
And I
just
think,
getting pregnant.
yeah, that's something I do feel like I hear often too is like with my clients who've experienced infertility, there's so much of like, I just thought once I was pregnant, I would feel better, right? I thought the anxiety would go away once I was pregnant. And unfortunately, right, most of the
Right.
time, that's not how it works.
No, because they're
So
waiting
to
for the
your
next shoe to drop,
Right, exactly. Yeah. Yeah. You're waiting for the next milestone, the
especially if
next
you've had
kick,
loss.
yes, exactly. Yeah. Yeah. Getting through and that's something too, right? Like being able to process through and target, like, okay, if I feel activated and triggered every time I go to the doctor,
Right.
like that's something we want to work through because
Right.
unfortunately, right, we're going to go to the doctor a lot during your
Right.
infertility treatment and
And
pregnancy and
pregnancy.
delivery,
Yeah.
postpartum, right?
Yep. Oh yeah. And
Yeah.
honestly, what is hard too, which is why I love that our appointments, like our initial eval is 90 minutes and then our
Mhm.
follow-ups are an hour. But like you go to the OB or the fertility clinics and you're in and out. And this is so common for them, whether it's recurrent loss. You have to have three recurrent losses in order for them to do something, right? Or you have to be trying for a year, or why
Right.
don't we do six IUIs or whatever? I feel like this is their job and they see this so often that the
Mhm.
time and empathy that they have for you isn't as
Right.
much, which is why I
Sure.
love
Yeah.
that, like, both of our settings, we get to sit down
Yeah.
and work with you and talk with
Yeah.
you
Yes.
and feel with you.
Mhm.
Like, we
Mhm.
want to be alongside you
Mhm. Mhm.
and because we understand the importance of that mental health aspect,
Yeah.
like
Yeah. Yeah.
physically. And
Yeah.
and the doctors just don't have the time for that. I mean, some of them are more
Sure.
empathetic than
Sure.
others, but like most of them have like 7 minutes with you max.
Right. Right. Yeah. Yeah.
So just having that time
Yeah.
with us
Yeah.
to help work
Yeah.
through the trauma
Yeah.
so that you can,
Yeah, because to your point, right, like infertility is really common, but that doesn't mean just because it's common and lots of people experience it doesn't mean it's not hard and that you don't
right,
deserve like adequate support and
right,
time
right.
to process through all of these
Mhm.
things.
Yeah.
Yeah.
Yeah. And I know, like, especially if you're disassociated, like that could even go into like your parenthood. If
Yeah,
you never feel connected
totally.
to the baby, and like I'm gonna be honest,
Hmm.
I'm an open book, but pregnancy was hard. And once I had a baby, I never felt connected because
Mm,
I never thought it was real.
yeah.
And I was always waiting for the shoe to drop. And so
Yeah.
even
Yeah.
like not dealing with some of those things prior can affect you in the future too.
Sure.
And
Yeah.
so
Yeah.
reassociating with the area so you can somewhat
Yeah.
somewhat enjoy
Yeah.
your pregnancy,
Yeah.
heal postpartum. Like
Hmm.
postpartum, whether you go through infertility or not, is
Hmm.
all about reconnecting with that area. So if we lose that connection,
Hmm.
it's going to be hard to heal there too. So I just think
Sure. Yeah. Yeah.
feeling like working through all of that
Mhm.
before is going to help you in every step of the journey, you
Well, and
know?
I think it also can make you feel, right, like it's another thing my body is failing me on,
Right.
right? Like it already failed me with infertility and now I don't feel connected or
Right.
now like, it's another, it feels like
Right.
another form of failure
Especially if you're
and
using a
betrayal.
surrogate
Yep.
or
Totally. Yeah. Or donor
or an embryo that
conception.
isn't
Mhm.
genetically yours,
Yep.
like
Yep.
that takes away an aspect of your connection
Hmm.
already.
Hmm.
So
Hmm.
figuring out ways to reconnect or I don't know, sit in this is what's happening. How
Yeah. Yeah.
best of this situation is so hard, but
Yeah.
that's where you come in to help that.
Yeah.
And Mercier can help you, and pelvic floor can help you reconnect
Yeah.
with that
Yeah.
area of your body
Yes.
physically, and sometimes can come out mentally,
Yeah.
emotionally too.
Yeah.
So, yeah. Okay. So if someone wanted to help their own like mental health, um, like doing day-to-day things, what are some things you recommend that they can do on their own?
Yeah, yeah. Yeah, so there's lots of different things. I think one of the first things I always want to check in with people about is me, like, okay, are we meeting basic needs, right? Because as we talked about, um, infertility is so all-encompassing. It feels like your whole life is surrounding it. Like, Are we drinking water? Are you moving your body in some capacity? Are we eating enough food, right? Because even the hormone injections can make you have lots of different cravings and things like
Yeah.
that. And so making sure, like, first and foremost, are we meeting our basic needs? Are we
Right.
moving? Are we sleeping? Are we eating? Are we drinking water? Like, let's like
Right.
Maslow's hierarchy of needs. Let's
Yeah.
start at the bottom,
Isn't
right?
that crazy? You got to think about things you think would be obvious, right? Are you
Sure,
breathing?
right. Yeah, right, exactly. Are you holding your breath?
So
Yes,
many people don't,
exactly.
and they're like, wow, I haven't really
Yeah,
taken a deep breath in so
yeah,
long.
yeah. And I want to be mindful of saying, like, are we moving our body? Because I feel like there's so much, especially in the infertility world, when there's so much misinformation about BMI, and like
Uh-huh.
a lot of clinics have a BMI cutoff before they will actually
Yeah.
allow you to seek treatment. And so
Yeah.
I don't mean like, are you exercising enough? I mean, like, are we just moving our body in a way that feels good to you? Because
Yeah.
it's helpful for our mental health. Like,
Right.
whether that's like, I'm going to take a dance break or I'm just going to
Yeah.
stretch, right? It's
Yeah.
much more for me. I'm like, are you moving? Because that then is allowing us to feel more connected to our body, right? Are
Yeah.
we doing something in a way that feels good to
Yeah.
us so that I can feel connection to my body? That's the important piece for
Yeah.
me, right?
I feel like too,
Um,
I say that to my clients a lot, like, but in a different way for different reason, but almost the same thing. It's like, what will downregulate your nervous system? What will get you
yeah,
away from the fight or flight? It
yeah,
doesn't have to be, meditation or whatever. It can be gentle movement. Someone was like, I want to pet my dog. Like, great.
yeah,
Like that, if that's what works for
yeah,
you, like that's what you need to do. If moving your body helps and it looks like walking around the block and getting
yeah.
chair, like, or doing yoga or stretching or just
Mhm,
sitting in child's pose and taking deep diaphragmatic breaths, like whatever
mhm.
it looks like for you doesn't have to look the same as your neighbor,
Totally. Yes. Yes.
but that can help you
Yeah.
reconnect with yourself and
Yeah.
downregulate that nervous system to get that rest and digest, get that blood flow to your reproductive
Yes.
organs, get those, muscles to relax and
Yeah.
movement, like whatever
Yeah.
works for you.
Yeah, yeah. And so I also like to do for for muscle tension and things like that, and just reconnection to the body, that a lot of people I think aren't, oftentimes we don't even realize we're holding so much tension.
Yeah.
So doing something just it's called a body scan exercise,
Mhm.
where you go like from toes all the way to head, like intentionally clenching and slowly relaxing and inhaling and exhaling with each sort of like muscle system, because we often, I mean, we walk around like this all the
Oh
time and
yeah.
don't even realize it, right? And so just
Mhm.
even that, like, okay, where am I holding tension? Where's my body holding tension? And helping us kind of like, again, reconnect. That's a good exercise I like to do. Breathing for sure, like you said, for down regulation. I like to use square breathing.
Yes, love that.
Yeah. And then also on top of that, right? Like mindfulness is really helpful. I know sometimes people have a hard time with that, or it's such like a
What is
like
it?
it gets thrown around a lot,
Yes.
right? Yeah.
Yes.
So
I just
but
think of
simply
meditation,
it just, yeah,
but
mindfulness just simply means like being present with where you are with no judgment, right? Just being really aware of what's going on. So it's like, if I'm going to have a drink of my coffee, it's like I'm going to take a sip of it. I'm really going to notice what it tastes like, notice all the different flavors, and I'm
yeah,
not going to have any judgment. If I'm like, "Oh, I shouldn't be having this coffee," I'm going to notice that thought and let it go away, right? It's just being very present in
yeah,
the moment, not in the future, not in the past,
yeah.
with what is. So
Right. I
really,
love
yeah.
that.
And
'Cause so
that
much
is,
fertility is grieving the past and
yeah,
like
yeah,
thinking about what the next cycle, like grieving the last cycle, thinking about the next cycle. So I love that
yes,
being
yes.
present because that's really hard, but I think is
Yeah, it is. Yeah. And if we can just, even for 30 seconds, if I can just like, I'm just going to sit in this moment here and now without judgment, without any sort of, right, like opinion about it. I'm just going to be and exist in
yeah,
what is. It
yeah,
can just, even that is a break, right? It's
yeah.
a break from the anxiety, from the planning, from the mental load of even of infertility. So yeah, just mindfulness. And then I think making sure we have good like stress releases, right? Making sure like Do we have a support system that we're able to talk to? Does that look like I'm setting boundaries with friends who are or family members who are asking me about having a baby too often?
Yes.
Or a friend who has children already that they only talk about their kids, right? Like,
Yes.
do I need to set boundaries with them because that's too triggering for me?
Right. Right.
Uh, being
Yeah.
mindful of social media intake. I think once you say the word baby, our
Oh my
algorithms
gosh. I
really
swear.
overpopulate things, right? So, being mindful of all of those things too, and setting boundaries. The boundaries exist for you and for the other person, right?
Yeah.
It's a reciprocal thing, not just I'm only doing this for myself, right?
Yeah. And I think those boundaries, like you said, help you stay in the present too,
Hmm.
instead
Hmm.
of like
Yeah.
going back to like the grief of what could have been or what
Yeah.
isn't,
Yeah.
which I feel like especially social media or friends or, can bring up a lot.
Yeah. Yeah.
I don't know if this counts, but something that I really like to do, I had a certain song that I would
Mm.
play in my car and blast and sing every day.
Yeah. Yeah.
And like I'd like kind of sit. I hear people say like, especially through infertility and shout out the Casey Infertility Conference was great. But they talked a lot about just like sitting with yourself and feeling all the feels. Like it's
Yeah.
okay to feel all of
Yeah.
the feelings.
Yeah. Yeah.
And I feel
Yeah.
like sometimes being present with yourself and allowing yourself to feel all those feelings
Hmm.
can almost help you like breathe, like get it all
Yeah.
out and then be able to like
Yeah.
breathe again.
Yeah. I feel like I hear so often like, um, okay, yeah, but like what do I do with all of this? Right? Like I feel, like what do I do? How do I get through it? And that is such a good reminder and almost answer to that question is like you cannot force yourself to not feel how you feel.
Hmm.
The only way to move through it is to allow yourself to experience it. Because
Yeah.
if we're spending so much energy saying like, I just want to be over this, I just want to be through this, right? That doesn't erase that we feel sad,
Right.
that we feel frustrated, that
Right.
we feel
Right.
grief and patience, right? And so allowing ourselves to feel that, to release it, not even just feeling it, but like if I'm actively in it, then I can work through it
Right.
versus like I'm going to shove it away because I
Right.
just want to move on to the next thing.
And I do feel like too that helps everyone else involved in your life.
Yeah.
Like your partner, whether are already a parent, whether
Yeah.
it's step kid, your kid, like you still have to parent, you still have to be in this relationship with your partner, you still have to be a coworker, like you still have to be all of these things. So
Mm-hmm.
being able to let that out and give that time for you so you can be a better you for everyone else.
Yeah.
But also remembering like you matter,
Yeah.
you
Yeah,
know?
exactly. Exactly. Yeah.
I feel like a lot of people forget that you just feel like a number going through the system,
Mm-hmm. Mm-hmm. Yeah.
you know?
Yeah. And your experience matters. Yeah.
Yeah. Okay, any other things you feel like people can do
Yeah.
on
Yeah.
their own?
I would say definitely like when if you're actively going through treatment of any kind, like making sure you're setting up a space that feels good when you're doing that. So like if you're having to give injections or take medications, if it would feel good to you to have your partner be involved in that,
Yeah.
making sure that's happening. And also, like I'll have clients like we can create some like affirmation cards to put on your
Yes.
wall or like with your
Yeah.
medications or,
Yeah.
just making that like a positive space, not just
Right.
another like sterile, really
Yeah.
like just here we're going again, right? Like making it's not a fun part of the process, right? But anything we can do to kind of
Right.
lighten it a little bit, I think can
Right.
be really helpful too.
Yeah, I love that. I know we're working on little affirmation card boxes for all of our Mercier patients, which I
Yeah,
love.
amazing.
And it's just good reminders. And I know one of the affirmations is like every cycle or it gets me closer to my baby. And that
Yeah.
doesn't mean your
Oh,
baby,
that's so great.
that
Yeah.
doesn't mean you're going to do IVF or you're going to do
Yeah.
adoption or like whatever it means. It just means you're one step closer, you're one day closer. It doesn't
Yeah.
necessarily look the same and it might not look how you look, but like every injection, every procedure, everything moving forwards brings you closer to your
Yeah.
baby. And it's
Yeah.
just like a a good rem these cards are just good reminders because we get so caught up in all of the scheduling and the planning
Mhm.
and how you should feel for everyone else and all the
Mhm.
things that,
Mhm.
like you said, those affirmations or making light of it or remembering like I will get through this. I don't know what it'll
Yeah.
look like,
Yeah.
but
Yeah.
it gets
Yeah.
me closer to, figuring out this
Yeah.
journey.
Yeah,
The journey
exactly.
will end,
Yes. Yes. Yeah.
but yeah. Okay, last thing. How do you feel like you can support your partner with this,
Yeah.
whether
Yeah.
you're the partner getting everything done
Hmm.
or you're the supporting
Hmm.
partner?
Yes. Yeah. So I think kind of what we talked about earlier, right? Like, though I think societally we consider this a women's issue, right? Like this can be impacting anyone, even if you're not the identified patient, right? So making sure I'd love a check-in. I love a weekly check-in between partners, even if it's like 5 to 10 minutes, just saying like, okay, like just where are you at for the sake of solely just like how are you doing? How can I support you better? Right? Those simple questions of like, how did this week go? How are you feeling supported? Is there
Yeah.
anything we can shift? And asking each other those questions,
Yeah.
right? It doesn't have to
Yeah.
be a big, long, like 30-minute thing.
Yeah.
It can be just a quick, like, how are you feeling supported? What can I do better?
Yeah.
To both of both
Yeah.
people can be, and just creating a safe space, right? I think, and being willing to say, to not take any sort of feedback personally, right? It's so easy to get defensive, and
Yes.
just really hearing it from a place of like, oh, this is what my partner needs, right? And that we're both like, this is happening to us, right? To both of us. Yeah.
Yeah. I love that too because I feel like sometimes you can have surface level, like, hey, how are you? I'm good, or how
Yes.
was your day? It
Yeah.
was fine.
Yeah.
Like,
Yeah. Yeah.
and having that, like, okay, we're gonna do this 5 minute check-in, and
Yep.
this is
Yeah.
when you need to be real and raw.
Yeah. Yes. Yeah.
And I feel like having that real and rawness can help you know how to support your
Mhm.
partner
Mhm.
and help you, keep that deep connection through this difficult journey.
Yeah.
I love
Yeah.
that. That's a great
Yeah.
idea.
Yeah.
Okay, what about like the community or
Yeah.
anything you can do? Like, is there anything you can do outside of just you and your partner or individual
Yeah.
couples
Yeah.
therapy?
So having a good sense of, I mean, as we talked about, infertility is really isolating. So finding
Yeah,
support is really important, whether that is a person in your life or getting involved in the infertility community. Kansas City Infertility has a really big presence in the area. If you're in the
yeah.
metro, they have a once a month support group that's peer led. Also, resolve.org is an online platform that offers support groups too it's a really great resource as well. Um,
Mm.
my support group, a shameless plug.
Yes, love. Been a part of it. Yeah, I know you too.
Yeah.
We
And
have
then mhm.
Mercier, like a little, which Katie, I'll have to add you in it just because I think
Yeah,
it'd be a great presence.
yeah.
But if you do Mercier treatment, we have like a closed Mercier group
Oh, great. Yeah.
where this webinar will be posted, but along with other ones, but where people can support one another or
Yeah.
vent or talk
Yeah.
or, ask for help or advice or whatever it is, having that support, I think is
Yeah.
really helpful
Yeah.
in this
Yeah.
group.
Yeah. And I think that's something that Angela and I have really talked about is like how do
Yes.
we create a sense of community for
Yes.
people experiencing infertility? And so
Yeah.
uh we are going to be hosting some quarterly events for people
Yeah.
experiencing infertility just to come and like connect and meet each other and like just
Yeah.
do fun stuff together.
Yeah.
So we'll have more information to come about that too, which I'm
Yeah.
very excited
And
about.
I think I joke all the time, and everyone I joke with that's gone through some sort of infertility is like, yeah, it's the best group you didn't want to be a part of.
Totally. Yes. Yeah.
Like
Yeah.
the there's so much support and
Yeah.
love out there for one another going through
Hmm.
infertility. This is making me like teary-eyed, but there's
Yeah.
just so many people out there, not just us, but there's so many
Yeah.
people out there that want to help you, whether you're in the beginning of your journey or in the thick of it. Like there's just so much support out there. So
Yeah.
don't feel like you need to go at this alone.
Yeah. Yeah. Yes. Yes.
But yeah, like
100%.
Katie said, we're gonna do like in-person events.
Yes.
So
Yeah.
they might differ in what we do, whether it's
Yeah.
just hanging out or
Yeah.
like doing like I'd love to do like yoga or something.
Yeah.
But yeah, so look out for your
Yeah. Look out for
email
that.
out for
Yes.
that. But that I think our first one's gonna be November.
Yeah.
So we'll come
Hmm.
out with a date and we'll kind of let
Yeah.
y'all know what it'll include. But
Yeah. That's going to be really fun. I'm very excited.
okay, so if you want to find Katie, I think your or your website is Katie at katiekirkenmeyertherapy.com.
That's my email.
Oh, that's
Yes.
your email.
Yep. My
Right.
website's just
Oh, well,
katiekirkenmeyertherapy.com.
that's easy.
Yeah.
And
Yeah.
then do you have an Instagram?
Yep. Instagram
Oh,
is just
duh. I tagged
Katie
you in
K.
it.
It's Katie K therapy. Yeah. Very simple. Yeah.
Okay, perfect. So we'll
Yeah.
include all that stuff. I'm sure we're going to email this webinar out.
Okay. Great.
So we'll include all that information. And then also, which I know you have a good presence in, is the Casey Infertility Facebook group
Yep.
is
Hmm.
also really great if you have like questions or just need support in a quick Facebook group. But yeah, so
Yeah.
yeah,
Yeah.
we would love to support you and love to
Yeah.
see you and just be there to walk through your journey with you.
Yeah.
So
Yeah.
thanks so much, Katie. It was so
Yeah. Thank you for
nice to
having
meet
me. This
you.
was so fun. I feel like we could have talked for like 2 hours.
I know, I know, I know. So yeah, if you want to come talk to us for two
Yeah.
hours. So.
Yeah. Right. Come hang out with us. Yeah.
Yes. Okay, well, I'll see you in November.
Okay.
Looking
Sounds
forward to
great.
it. Okay,
Okay.
bye.
Bye.